The county bosses say that they have no money to add to salaries and allowances. So what is the way forward? Tonight we speak to Kakamega Governor Wycliffe Oparanya, who is also the chairman of the Council of Governors. Keep talking to us, be part of this discussion. Send us a message on 22047. The hashtag to use on Twitter is TV47 News. Good evening, Governor, and thank you for making time for us tonight on the county's television.
Good evening, and thank you very much for also inviting me.
All right, Governor, with a cash crunch in the counties, a paralyzed healthcare system, two threats of a shutdown, a sue in the latest is devolution, the very idea that was birthed by Kenya's 2010 constitution, working?
Can you come again? I can't hear you properly. There is an echo.
All right, Governor.
So can you come again?
Can you hear me now, Governor?
Yes.
Good. I'm asking, with a cash crunch in the counties, a paralyzed healthcare system, threats of a shutdown, is devolution, the very idea that was birthed by Kenya's 2010 constitution, really working, Governor?
Thank you very much. I can tell you that actually devolution is working. Mm-hmm. And I say so because if you move around the counties, go to any counties, and compare what has happened in those counties for the last 8 years or so, mm-hmm. you'll find that there are so many changes that have taken place in all sectors, whether it is roads, it is agriculture, it is water and environment, it is health. So I can assure you that despite the challenges that we have had mm-hmm. all along, devolution is working.
Governor, you say devolution is working. With the counties crying of lack of finance, the standoff on the revenue sharing formula that was an ugly spat last year, a paralyzed healthcare system that is forcing Kenyans to bear the brunt of it, one will question there are more failures.
I can say that the issue of revenue sharing has been a very thorny issue. Mm-hmm. But you are aware that the Council of Governors went to court, and the court interpretation mm-hmm. has really favored the counties. I'm hopeful that come the next revenue sharing, the issue of stalemate will be an issue of the past.
Mm-hmm. All right, Governor, in the current constitution under Article 202, the constitution provides the revenue raised nationally to be shared as per a formula guided by of course, a formula that has a guideline to it. That sees 15% get to the counties. There are promises of 35% courtesy of BBI, which you are one of the lead proponents to. Is it not an irony that 15% is not getting to the people, yet there is a promise of 35% on the table?
That is an unfortunate situation. Uh-huh. And that's why I say that the national government, through the National Treasury, should have their house in order. Mm-hmm. Because the 15% actually is the minimum. I can say that at the moment we are about 22 or so percent mm-hmm. that is coming to counties. And if you put grants that we get, maybe it might be slightly over 25% mm-hmm. that we get. I think there are still functions, and when we had a stalemate 2 years ago, mm-hmm. we carried out an audit, and we found that the national government is still performing functions that are supposed to be performed by the county governments. And at that time, 2 years ago, we found that there was 150 billion in the budget of the national government that actually was for functions that have already been devolved. So if the national government was to relook at their national budget and transfer those functions plus the related resources to the counties, because the Constitution says resources follow functions, it will be possible then to raise the 35%. And I'm saying so because look at what water boards are doing. These are duplication of actually what we are doing. Sectors
Governor,
like agriculture.
Governor, I asked you that question because the standoff at the cash crunch in the counties is because of the failure of Treasury failing to disburse funds to the counties. And we are talking of 15 to 20%. There are promises of 35%. Surely one will say those are semantics.
I have clearly explained that 35% can easily be achieved.
How?
If the money that are held up, I have mentioned to you that we looked at the budget 2 years ago, the national budget, and found that the national government had budgeted for functions that already are supposed to be transferred to the counties. And at that time, the value of these functions was 150 billion Kenya shillings. So if that functions were actually transferred, plus the related resources, then achieving the 35% would be quite easy. But this is easier than done, because I think some officials at the National Treasury are not committed to devolution. If they were committed to devolution, the 150 would have been transferred to the county government. But I'm hopeful that with the passing of BBI, and there will be that commitment, whichever government will be there will be forced to make sure that 35% of the revenue goes to the county government.
Governor, you say there are some officials at Treasury who are not committed to this idea. How high or junior are they in ranks at the Treasury, if you know them?
You know, I can't mention names here because Treasury is an institution, and that is particular institution has leadership, and there are other support people who are there. So I'm saying that the entire Treasury actually is not committed to devolution. Why I'm saying so that now, for example, it is 4 months we have not got disbursement to counties. Although we know that we have had challenges, but you can see that national government employees are being paid. County governments are resorting to borrowing money from banks, which to me I say is illegal because proper procedures are not being followed. But how long are we going to do this?
All right, Governor, I want us to move from the cash crunch in the counties, but one final question on that. I was looking at the report of the controller of the budget, which shows that only 3 counties, namely Kirinyaga, Migori, and Tana River, met their revenue target during the first quarter of the 2020-2021 financial year. First, what is the greatest impediment, if not hurdle, to the counties meeting their financial revenue targets?
One, let me tell you that we need technology. The counties have to embrace technology to make sure that they maximize on collection of own revenue. That has been a challenge, and sometimes that technology needs a lot of investment for you to achieve the expected targets. Secondly, with now the COVID problem that we have had for most of last year, and it continues now, it is going to be very difficult for counties to achieve their targets. And that is likely to continue forever. And the disruptions that we are having, like these strikes, because health facilities, especially level 4 and level 5 hospitals, are a source of own revenue, because you get revenue from the health facilities, and then you plow back in terms of development or in terms of buying medicine. So because of this, it is unlikely that in this year, any of the counties will be able to achieve the expected targets or their budgeted targets.
All right, Governor, let's now talk of the unhealthy standoff in as far as the strike of clinical officers and nurses is concerned. I believe yesterday in Malava you said, and I quote, that even if the strike will take a whole year, we have no capacity to handle the demands. We are limited by funds, and we cannot lie to the unions that we will give them. You echoed that in an earlier press briefing today. First, when you say such statements or statement, do you say it as the governor of Kakamega, or you say it as the chairman of the Council of Governors?
I say it as the governor of Kakamega County, because financial commitments are based on individual counties' capacity or budget allocation. Let me say this. You know, this strike was uncalled for, because most of the issues that were raised, the welfare issues that were raised, had actually been dealt with. They complained of PPEs. Some of them work without PPEs. But this was a general statement. They could not specify which particular counties were not giving PPEs. And in any case, if you are an employee, will you attempt to approach a COVID patient without PPEs? So this was a general statement.
But Governor, is that not the condition? Let me interject you at that point. Is that not the condition that these striking nurses and clinical officers are saying they have been subjected to?
Yeah, that's what they are saying. But have you read anywhere where they say it is Kakamega or it's Kisumu or it's Mandera which is not providing PPEs? It's a general statement. And in any case, we have insisted and said that if there are problems, they should be specific, because counties are dealing with these issues at various levels. You can't lump and say that counties are not providing PPEs, counties are not providing the insurance that they require. You know, like my own case, I have never had my own medical staff complaining about PPEs. If it is insurance, I've taken insurance for not only medical staff, but I've taken for all workers through the NHIF enhanced medical insurance cover. The issue of last expense, this is provided for in our normal human resource manual. And the issue of risk allowance, which have been a sticky issue. You know, we as counties, we have no powers at all to increase anybody's allowance unless it is approved by SRC. And also before you do that, you must make sure that this particular allowance you are increasing is budgeted for. If it is not budgeted for and you are increasing, then how will you implement it? You will need again to go through a supplementary budget, which is I can tell you is a long process. So the issues they talked about welfare, I feel very, I feel that all counties have dealt with on these issues.
But Governor, Governor, allow me to ask this. You say that is a general statement. Is it not of an evidence enough when we have nurses and clinical officers who have died in the line of duty, and their unions say they died because they contracted the virus in the line of duty for lack of PPEs? There's evidence to that. You are not refuting that tonight.
My friend, I need that evidence that actually people or health workers have contracted COVID-19 by working without PPEs. I don't believe in that.
But when they contract in the line of duty...
To say, I want you to give me an exact example that in this county, this particular person contracted COVID-19 because she or he worked without PPEs. That is a general statement, my friend. We have been asking specifics. We have never got any. And remember, while they are saying this is a general, while I'm saying this is a general issue, there are 13 counties that the medical workers never went on strike. How come if it was rampant, how come the 13 have never gone on strike?
All right, Governor, you say...
And the issue of the issue of allowances, I want to say, last time when they went on strike, we agreed on varied adjustment of their allowances and salaries. And at that time, there was a general increase of 5.2 billion, which was shared across all counties. And this was a great financial strain. And we are saying that this particular medical worker are not the poorly paid. Come and compare that what are other workers within the counties being paid. There are people in roads, people in water, people in agriculture. Compare. Go out there, my friend, and compare in this country. How much is a nurse working in a private institution like Nairobi Hospital, MP Shah, Aga Khan, being paid, and come and compare what the national government is paying. There is a big difference. It's nearly double. So how are we going to sustain this? Is Kakamega County there to just pay wages without looking at the other welfare of the people, without doing any other development? And that's why I'm saying that unless I get additional allocation from the national government or from the treasury, then there is no way as an individual governor I can afford to pay. And it will not be fair. I'm struggling to pay people's salary and I'm not doing development. Is that fair?
All right, Governor, you allude to the comparison of workers in the county level. There's no doubt, and you have a point there, that healthcare workers at an entry level are paid better than a large number of the county workers. But still on the question of you challenging me to give you an evidence of medics and healthcare workers who have died, we have more than 10 specialized doctors who died of COVID-19, more than 15 nurses, the latest and the national face of that being Dr. Mogusu, a 28-year-old doctor who died in the line of duty. You are disputing that, Governor, aren't you?
That one I agree, and it's unfortunate that we lost such important people, people who have been actually taking care of others. But what I wanted you to mention to me, did they die because they treated patients without PPEs? They
died because they contracted COVID-19 in their line of duty.
Yeah, in any case, this disease you can get it anywhere, yeah? And they are the ones who know it is a risk. If you know actually you don't have a PPE and this particular patient is suffering from, has been confirmed as a COVID patient, will you risk attending to such a patient without a PPE. So unless they forgot and maybe they didn't know that patient had it was a COVID case, then that is unfortunate. Otherwise, any doctor who is trained or any medic who is trained will not attempt to approach or attend to a COVID patient without a PPE. So to me, a PPE is neither here or there. If it happened, then that's unfortunate.
All right, Governor, a bone of contention in the disagreement of the signing of the return to work formula is the enhancement of risk allowance to 30,000 shillings. You say you do not have, as counties, the capacity to do that, but understanding that healthcare and health is a devolved function under the 4th schedule of the Constitution, you're saying the county bosses have no role in passing that?
I have said clearly that you imagine a risk allowance increasing from 3,000 to a minimum of 19,260. Can you see that difference, that increase? If I'm having 3,000 nurses in my own county, if you multiply out that difference, who will afford that? It will be difficult unless you say you stop everything else. That will be your focus. And obviously, if the county does not move forward, it will be me as the governor who will be blamed. So we are saying these demands are outrageous. You will have said, okay, this is a case we know we have COVID. COVID is there. They are working under risky environment. This is for their welfare, to make sure that we take care of them. Let's increase it from 3,000 to 5,000. But if you talk of 3,000 to 19,000, who will afford that?
All right, Governor. Of course, this discussion was pegged on the cash crunch situation in the counties and the standoff in the healthcare system. But nonetheless, I won't finish before asking you this one final question, and this is more on politics and more so Mulembe unity. Why is the Mulembe community, in the words of Peter Kenneth, not walking the talk in as far as unity is concerned?
I can assure you, as one of the leaders from the Mulembe nation, that actually we are united. The only issue is that the interests, sometimes interests vary from one leader to the other. And the fact that also we are more democratic, maybe, people. You find that we have quite a number of parties within the Mulembe nation. We have the ODM, the ANC, Fort Kenya, plus others that are coming up. Maybe that is our undoing. But it does not mean that if we have various parties, we are not united. Maybe we have not had maybe someone to actually be committed to bring us together, and I'm hopeful that maybe someone will do that in the near future. That might be our undoing, but let me assure you that going down there, the people themselves actually are very united, and that's why look at the past general elections. When it comes to presidential election, they have always voted together. They come, and maybe when it comes to the level of member of parliament, to the level of MCS, maybe they vote the way they like, or they vote along the party line. But if it comes to presidential elections, they vote together, all along.
All right, Governor, and that's where we will have to end this discussion. Once again, thank you for making time for us tonight on TV 47.
So thank you also very much for inviting me.
All right, Wycliffe Ambetsa Oparanya is the chairman of the Council of Governors and also the Kakamega governor. Keep talking to us. The discussion continues online. Send us a message on 22047. The hashtag to use is TV47 News. I understand it's time for us to get to the world of sports now. Let's bring in